He is very sweet and he loves other kittens. So when I foster kittens, he's sort of the big brother. And he's very mellow. His heart condition makes him so that he knows to self-regulate, that he shouldn't get excited. Cocoa Puff was born in December 2017, and he was surrendered to Foothills Animal Shelter. And he was one of my kittens that I fostered. He was having problems with the upper respiratory infection. They determined one of his valves of his heart was enlarged, and he was sent to Dr. Lick-Bacart for an echocardiogram.
So Cocoa Puff first came into our care about a year before he then came into our emergency room, and he had just come in for a workup of a heart murmur. And so that's when we initially diagnosed Cocoa Puff with a relatively uncommon type of congenital heart defect called tetralogy of Fallot.
They originally thought that he wouldn't live past 6 months, but at 9 months they said, well, maybe it'll be, a year or two, but he's 5 years old now, and he gets yearly echocardiograms. He was outside. He didn't go out very often, but he went out once, and he came back dragging his back legs. I didn't know if he got caught on a fence, hit by a car.
Cocoa Puff came in through the Evolution Veterinary Specialists emergency service after having been hit by a car. There was pretty severe trauma to both of his knees.
And they assessed him and said that he would need surgery.
Cocoa Puff's case was unique in the fact that he had a congenital heart abnormality that would definitely complicate anesthesia.
And before they would do that extensive surgery, he had to have another echocardiogram to see if he could survive the surgery.
So his congenital heart defect definitely played a factor. It is a relatively uncommon cardiac defect, so having a cardiologist come in and kind of evaluate the heart function, and then getting an anesthesiologist in to work the plan to make sure that the anesthesia was functioning appropriately with his heart so that we could keep him anesthetized.
And Dr. Lick-Bacart did the echo prior to the surgery, and he was fine. That didn't seem to affect him, and he came out of surgery very well.
His prognosis is actually relatively good. So typically once they make it past like 1 to 3 years or so without clinical signs, these guys will do pretty well. Potentially may have some complications at older age, but right now he's doing really well, and generally feisty cats do better, and he's pretty feisty, so I expect him to keep coming and see us for quite some time.